And welcome back. We have a couple guests with us right now from New Life Cancer Centers. I'd like to welcome someone you just saw in that spot right there, Nicole DiRienzo. Did I pronounce that right?
DiRienzo.
DiRienzo, nice to have you here today.
Thank you.
And we also have Dr. Michel Baudry. Nice to meet you, sir.
Nice to meet you.
And it's great to have you both here. So first of all, let me ask Nicole in general, tell us about New Life Cancer Centers. Where are they located, and what is their focus?
Well, our corporate office is in Newport Beach.
Mm-hmm.
Right now we have a facility in Baja that is treating most of our patients currently.
Mm-hmm.
But in about 4 months we will have another location in either Newport Beach or San Clemente.
Okay.
So our main focus is targeting tumors
Mm-hmm.
without the residual effects of the normal chemotherapy
Okay.
way of doing things.
Okay. Now, do you focus on more advanced tumors or get them at the early stages? Do you differ that way from other cancer centers, or is it just all of it?
We've found that later stage patients are more aggressive in their treatments.
Okay.
And so usually we have had stage 3 and stage 4 cancer patients.
Okay.
But no, we won't turn anyone down.
Okay,
from
I didn't
wanting to
know if
destroy
you
their
kind of
tumor.
like that's what you specialized in. So I wanted to-
No, generally our patients will have tumors that continue to move around their body, so
Okay.
they want to get as many as they possibly can
Okay.
because the treatment is fairly quick.
All right, and that leads me to you, doctor. There is a different kind of treatment that you use, and we want to talk more about it. It's called Sonata Plus, right?
Correct.
So tell us about that.
So Sonata Plus is a brilliant idea of its inventor, Dr. Beaufayou. So his idea was to say, instead of giving the traditional chemotherapy, radiation therapy, let's directly attack the cancer itself. So cancer is a growth of cells which create a mass of cells. And the traditional therapy has been to say, we'll give chemotherapy or radiation therapy to try to kill these cancer cells.
Right.
His idea was to say, directly target the cancer itself. So he combined 3 different drugs to attack these cancer cells. So one drug, which he puts right in the middle of the cancers, is there to kind of loosen up the cancer cells. The second drug is a traditional chemotherapy drug, but he puts it directly in the middle of the cancer, which it can be used at high concentration, which is going to indeed kill the cells. And then the third compound that he put in this mixture is in fact a really genius idea because it boosts the immune response. So when the cancer is growing, some of the cells are going to metastasize and spread around the body, where they are going to go implant in different tissues, create a new cancers. So his idea was, by boosting the immune response, now the immune system of the patient is going to attack these cells which have been spread around. So these 3 ingredients that he put directly into the mass of the cancer not only is going to kill this cancer directly, but it's also boosts the immune system to help to kill the other cancer cells which are spread around the body.
Okay. How do you determine a patient that is appropriate for this treatment versus radiation or gamma ray or any other type of numerous other types of treatments?
So pretty much as Nicole was saying, you know, we are targeting stage 3, stage 4, which means that for these patients, a lot of time the cancer is already spreading and has created other small cancers in other parts of the body. So if you do with a traditional therapy, radiation or chemotherapy, radiation, you will need to try to target different, location in the body. Here, we can also, if the tumors are big enough, we can inject directly into the different tumors, but also by injecting in one tumor, that's also going to help the body to attack the other tumors.
Okay.
So we don't really need either the radiation therapy, the chemotherapy is incorporated in the treatment, and if needed, we can do multiple injection in different cancers.
Okay, obviously, depending where the cancer is in the body, it can react quite different. As we know, cancers are not all created equal. So can this be used on any type of cancers?
As far as we know, this has been used on any type of cancers.
Okay.
And so you have to realize that Dr. Beaufayou, the inventor, has been doing this in China for 20 years, and he has treated something like over 30,000 patients with all type of different cancers, and has been quite successful. And so he has collected data showing that indeed this treatment is superior to the traditional therapy treatment.
And how long does the treatment last, or is it just totally depend on the patient?
So in
What's
general,
the schedule, basically?
in general, the treatment consists of 3 injections about 1 week apart.
Okay.
And so if it's generally, this is sufficient to pretty much get rid of a cancer. But at least make it really, really small. As Nicole pointed out, it's like the analogy would be that cancer is like a grape, and you directly shoot the grape and you make it into a raisin.
Yeah.
And and then the body will slowly get rid of this this residual raisin.
Right.
By its immune system.
Heard it through the grapevine, right?
Right.
So as far as you talked about that taking about 3 weeks or so. What about regardless of the different kinds of treatments, there's always a chance of a reoccurrence.
Correct.
So does this method seem to prevent less of that reoccurrence?
Generally, yes. Okay. Now, if indeed the cancer reoccurs, you can again do another injection. Okay. So depending on where the size of a cancer, so the size of a cancer actually determines the amount of chemicals that you are going to inject. So if you have indeed a big cancer, you are going to inject more chemicals. A small cancer, much less chemicals. Now, indeed, once the cancer has shrunk, and for some patients, the cancer does not come back. If a cancer comes back, nothing prevents it to do a new injection.
Okay. So you obviously monitor the patients.
So we follow the patients.
Okay.
Right. A regular schedule of chemo would be 6 to 8 weeks.
Right.
6 hours a time or for injections, and then it ends up destroying everything in your body. Right. Everything in its path, good or evil, chemotherapy destroys it, or radiation burns it from the outside. The difference in Sonata Plus is that it's literally one injection once a week, and it destroys the tumor. Well, if a tumor pops up in your lung and then you had pancreatic, well, then we spot treat that spot. We can move it around because it doesn't destroy your immune system.
Right.
The medicine is coagulated within the tumor itself.
Okay.
So it doesn't disperse through your body.
Yeah,
so you stay healthy. We're just killing the tumor.
Right.
Yeah, so the chemical that you inject remains inside the tumor, does not diffuse throughout the body. Like traditional chemotherapy is going, as Nicole mentioned, it's going to be distributed throughout the body and is going to indeed, kill cells which are rapidly dividing.
Right.
So here, because you put the medication right inside the cancer, the medication stays inside the cancer, does not diffuse throughout the body and starts, having side effects.
Okay. Nicole, one of the common questions we're going to have with all this, obviously the demographic we have here, is this something that is covered through insurance and or Medicare? I mean, people want to know that because, it can be a big issue for them.
It's like we said, it's a fairly new treatment here in the United States. The patients that we have treated here are doing wonderfully, actually. Their tumors are gone. But I don't believe any of them have used or submitted it to their insurance companies yet.
Okay.
It is FDA-approved chemos, so it might be something that they can submit to their company, almost like a therapy, a psychotherapy thing, and you see if you get an EOB back.
Okay.
But we haven't come across that yet. It's not alternative, but in a way, it's being treated as an alternative.
So how does someone then set up an appointment with them, with you folks?
We have our website, which is a great way because it's got an 800 number that anyone can contact us pretty much at any time. Okay,
and obviously that's newlifecancercenters.com, so you can go there. And we have the local number here, the 949 number, which I'm sure is fine too, 949-939-0050. So they can call you directly. They don't need to go to their primary. I guess what I'm getting at what point in time, you talked about this is quite often stage 3 and 4 cancers, not always, but sometimes. They probably up until then have been working with a primary and or specialist through their network. At what point in time then do they should they be consulting with their current doctor and say, hey, this is something I want to look into?
They will probably go back to their oncologist and tell them what they would like to do. Their oncologist will probably know nothing about it because, like Dr. Baudry said, it's fairly new. It started in China. It's been used for 20 years, but it's new to the United States. It's an untapped market here.
The reason I mention that is, of course, if they're taking current medications, whatever they may be, they need to know is something going to be reacting with. It could be any kind of medication that they're taking.
So, yeah, I mean, so it's clearly something that we are working on at New Life Cancer Center to indeed try to get, so as Nicole says, all the ingredients are FDA approved. Now the combination, a doctor can decide to use this combination. And that could be indeed, submitted to the insurance company for reimbursement. What we would like to do at New Life Cancer Center is to get it, completely, indeed, FDA approved as a new therapy for all patients, which, and then start maybe this discussion with, insurance companies to say, under which condition they would indeed agree to reimburse this treatment.
Okay, all right, very good. Again, the website, very easy to remember, newlifecancercenters.com. The local number, I imagine that's your Newport number, right? The 949-939-0050. Of course, if you go onto the website, you'll probably see their 800 number, which is perfectly fine too. Nicole, nice to meet you.
Nice to meet you.
Very
Thank
nice.
you.
And Doctor, nice to meet you.
Very nice to meet you too.
Take care.
Thank you very much.
And we'll be right back.